yourself, or for continuum of care program yourself, if you're a bigger area such as Grand Rapids or let's see, Detroit, Lansing, an area like that, if you're going directly to HUD yourself, you're known as a COC body because that's how HUD sees you. HUD sees you as your own COC body. If you don't go directly to HUD for money, like a lot of little communities around the state, you're known as a local planning body. That's how HUD sees you. Regardless of whether or not, which you are, a COC or a local planning body, you're basically doing the same type of thing. You're getting folks, a continuum of care body, as you know, or a local planning body, gets folks together within the community and works to solve homelessness as in a partnering, collaborative type environment. But those are just little nuances of how HUD sees you. And you look at page 5 that lists out the areas of the state that do go directly to HUD. The ones on the bottom of page 5 do go directly to HUD, and they're known as continuum of care bodies. The counties on the top of page 5 do not go directly to HUD, and HUD sees them as local planning bodies. The next page of this NOFA, page 6, talks about how there's 2 vehicles to get homeless money to the states across the U.S. One out of HUD that is. One is the Emergency Solutions Grant Program. That's an entitlement-based program. And MSHDA gets about $5 million, and then we match that dollar for dollar. MSHDA does a match on that. The other one is the Continuum of Care program. That's about a $9 million program. We have a new person here working at MSHDA who reports to the COC program chair, and her name is Christina Szilard, and she's heading up right now that Continuum of Care program. Those applications, we work with HUD in the summer on that program, or that's more of a July program, where the ESG NOFA comes out fairly early in the year. It came out March or April. We do webinars on it, and then the grants don't start until October. So in summary, there's 2 programs. The COC program and the ESG program are the 2 vehicles that get money to the states for ending homelessness. Page 7 has the pay for performance measures that we're going to use this year. They are the same as last year, only we upped the percentages a little bit. For example, number 1, it's the percent of rapid rehousing folks that came from the streets, shelters, transitional housing. And I think that was 75% last year. We raised it to 80 this year. Measure 2 is on vets, housing veterans, and successfully doing that. Measure 3 is on rapid rehousing and discharging people into permanent supportive housing so that you rapidly rehouse them and you're successful, either getting them on a voucher or getting them to stand on their own 2 feet, that type of thing, that you successfully discharge them into housing that they stay in and don't relapse into homelessness. 5 is on SPDOT, doing a SPDOT. 6 is also on SPDOT. 7 is on decreasing the length of time that people, COCs that have decreased the average length of time individuals remain homeless, like decreasing the length of time that somebody's homeless. And number 8 is if you do get money directly from HUD for the COC program, or you get money from MSHDA for the COC program. Remember, the ESG and COC programs are 2 separate programs. So if you are getting money through MSHDA for the COC program, if you can spend down, show us that you spent 93% of that money, then you qualify for number 8 here. And how you can prove that you spend that money down is by a signed letter from your COC chair that says that your community has done that. So we've added that to this NOFA just since yesterday when we did a webinar. People were asking that question. Last year we were trying to get letters from HUD, and HUD would not provide them. And we were also trying to get screenshots, and HUD didn't like us doing that. So we kind of came down to the conclusion that what we would take is if a COC chair says, yep, they've spent 93% of their money for the COC program, and the chair will sign that, date that, send it in to MSHDA. We'll take that for number 8. For number 8, if your community doesn't get these dollars, these COC program dollars at all, your COC or planning buddy does not receive that money, you just don't qualify for it, period. There's no getting around it. You just don't qualify for it. You need 5 out of these 8 items to get the pay for performance. And it's important that you run your data ahead of time so that you can make corrections to it, and you know how we're going to see it. You can run it, show it to your homeless assistance specialist at MSHDA. Just say, hey, this is what I got. Is this what you got? And check this stuff ahead of time, because we're going to be running it in early July. And what we run is what we're going to use. So it's important that you look at your data now for this 1 through 8 on page 7. Next page, page 8, we talk about specifically about the ESG program and what it does. For those of you who are new on the phone, the Emergency Solutions Grant Program came into effect in the late 80s was legislation put out to the federal government by 2 folks working in Washington, 2 senators, or I don't know if they were a senator or representative. Their names were McKinney-Vento. That was the last name of each of them. One was McKinney, the other was Vento. They put together this legislation for this Emergency Solutions Grant Program, and it was Ronald Reagan actually signed it into law way back then. So the core strategies for ESG are to ensure that there's emergency housing for people, for homeless people, for communities to work together collaboratively as COC bodies or local planning bodies to end homelessness, to realign programs, to build political support and will for ending homelessness, to create a communication plan and a coordinated entry plan. You know as a community that you can't do this on your own, that you need a lot of support. And then to look at the data, how are you going to do continuous quality improvement to your programs? To complete the quarterly CAPER report. The CAPER report is a Consolidated Annual Performance and Evaluation Report. It's known as a CAPER report, and it has your data on it, and it comes into MSHDA quarterly. The next page, page 9, talks about housing first, and also the strategy of not forgetting about and still using interagency service teams. Interagency service teams are consists of people, high-level people at agencies that work together, that figure out how to house the most difficult people to house, people with maybe mental illness, substance abuse, poverty, really extreme poverty, how to get those people housed. And an interagency service team consists of people who know people, that can just make the connections and figure out the really difficult cases. So that's important to have them as well. Number 2, Roman numeral 2, grant terms. Again, the grant term begins October 1st of 18 and ends September 30th of 19. Under defining homeless persons for the Emergency Solutions Grant Program, Roman numeral 3, it's the categories that HUD has. Category 1 is for people who are living in public or private places not meant for human habitation. For example, living in a car, a park, an abandoned building, a bus or train station, an airport, or in a campground as well. And then 2 underneath it talks about people are also considered homeless if they are living in transitional housing, in motels, hotels paid by DHHS or by other charitable organizations. And then we get down to category 2. This kind of is talking about prevention, helping people who are 14 days or so that they're going to be homeless. They've lost their home. They're going to be losing their housing. And then category 4 talks about domestic violence, human trafficking. So those are the groups of people that you help with this money. Page 10, collaboration. It's important that you collaborate and you coordinate your resources, that your coordinated entry materials up to date, that you know when the HARA is open, you know what you're going to do on weekends, that you build a memorandum of understanding between the grant fiduciary, the HARA, your sub-grantees. Everybody knows who's doing what. And you have one designated fiduciary, and that's the person that oversees the grant. They bill the state through the MAT 2.0 system, and they sign the grant. So that's what the fiduciary does. And we're going to get into now defining the role. Specifically on the bottom of page 10, it talks about defining roles. So what does the COC or the local planning body, what do they do? It's a really important group that leads and talks monthly at the top, the continuum of care body or the local planning body. They specifically decide who's going to be the HARA, who's going to be the fiduciary, where the grant money is going to go. The HARA, it's important to know that the HARA, when you go to a HARA, that's where all the ESG money goes. All the financial support goes there. The HARA also keeps the waiting list for the homeless preference vouchers. MSHDA has approximately 28,000 Section 8 vouchers, and those are all preference to people who are living in homelessness. So they are preference, they get the vouchers first. Out of that 28,000 MSHDA has, we probably have at least 10,000 by now that were formerly homeless. And Michigan is getting its homeless numbers down, whereas some states the numbers are going up. And I kind of attribute that a lot to the availability of that Section 8 voucher that MSHDA makes available. It's definitely stabilizes people quickly, and it's a great tool to use to end homelessness. So if you have PHAs in your area that have vouchers, you should definitely talk to them about preferencing their voucher to homeless people as well, people living in homelessness. The HARA also looks at the project-based vouchers. So there's two kinds of vouchers, right? There's the tenant-based voucher that goes with the tenant wherever they move. Then there's project-based vouchers. Those are assigned to a development. And you want to make sure that you know where those developments are and you're keeping those waiting lists full and using those units as well. So there's tenant-based vouchers, project-based vouchers, and the planning bodies need to really look at that stuff because they're great vehicles for housing people. And then there's also the veterans and trying to reach functional zero for veterans in your community. Another really important link is linking people at the HARA to the MSHDA specialist that, hands the voucher to the person that's homeless and helps them find housing, does HQS, making that link with that staff person, somebody from the HARA, and the housing agent, the MSHDA housing agent. That link is really important. So if you're a Continuum of Care chair on the phone today, or you're a HARA, just be sure that you know who your MSHDA housing agent is and that you have a good rapport and relationship with them. Page 11, just some more things on what a Continuum of Care body does. They build a culture of trust, and they make decisions based on outcomes. important that they know how to link the HARA and link people up to community mental health and substance abuse services, how to get veterans the support they need, to ensure that their community is practicing strength-based case management. Don't tell people that you're going to give them 6 months worth of rental assistance. Work with them monthly at the HARA to try to help them stabilize and pay on their own rent if they can, like that. The continuum of care body also knows about the point in time count, how important that is every year. They take minutes and they work with, when you do have, the meetings, take minutes, work with your MSHDA homeless specialist as you need, and then also work with MSHDA and MDHHS as well. Page 11, what does a grant fiduciary do? I talked about it a little bit, but they know who all the key partners are. They know who the chair is of the continuum of care body or the local planning body, who the HARA is, who the executive director of the HARA is, who the subgrantees are. They sign the contract with MSHDA, and they initiate and execute work with the subgrantees as needed. They bill MSHDA on the MAT 2.0 billing system. They keep the FSR so that the state knows what you're billing for. They have somebody on staff that knows accounting, that can that has kind of a business background, that either has some college background or just bookkeeping experience. Page 12, Housing Assessment and Resource Center. What do? Again, they get all of the financial money that goes out for prevention and rapid rehousing. It's important to know that the HARA has to help people with zero income. You can't turn people away just because they don't have any money to pay their rent. You can't turn them away. You have to help them. Again, the HARA keeps the Section 8 waiting list. They know about the project-based vouchers in the area. Let's see. They do the SPDOT, work with the CAPER reports, make referrals to other agencies, to some of the subgrantees that need case management assistance. And the subgrantees, they're responsible for kind of all the same things, for entering into HMIS, for providing backup and support, case management services to folks that need them. So that's what the subgrantees do. Page 13 just talks a little bit more about the fiduciary, which I've already talked about. One important thing to note, though, is on HMIS is to get that CASOBA signed so that you can share information across your agencies there, so that if somebody comes in, once that individual, that homeless person signs what the CASOBA does is just allows agencies to share information so that everybody knows who is, last spoken to Tim Smith, or whoever walks in your door, and what services have been provided for them. The HARA has to remain the same from year to year. We like to keep that continuity unless something's just really going on and you can't do that anymore. That agency cannot do it anymore. Then let your homeless assistance specialist here at MSHDA know, and we'll work through that. Something else so important for a HARA is to have hours that are posted on the door. And a HARA cannot just have a phone-in system. You have to have, you have to be open sometime. Yeah, and you have to have your hours posted. You have to be open sometime between Monday and Friday. Just post it on your door if your hours are 8 to 6, or maybe you're a small rural area and your HARA is just open from 8 to 2 or 8 to noon or something like that. That's okay, but just post it on your door. And again, no just phone-in systems. Okay, let's see. Page 14 gets into how can you spend this money. The parameters, the use of funds, that's number 7, Roman numeral 7, use of funds on page 14. Talks about 40% of the money has to go to the HARA. That's just, that's a federal regulation, actually. But if a sub-grantee is going to get a raise, say you want to give a sub-grantee a $3,000 a year raise, you also have to give an equal raise to the HARA with this money. You have to give an equal amount to the HARA. Our goal with this is to keep the HARAs strong because they are the central point of intake in busy agency, needs financial support. It's like the kind of the go-to for homeless people, and it has to be a solid organization. Page 15. HMIS is capped at 10%, and administrative is capped at 7.5%. 7.5% is a HUD limit. That's what HUD puts on admin as a cap. And HMIS entry, we put a 10% of the grant amount goes that you can use that for HMIS. No grant. The continuum care body is you decide who gets money, who's going to get what money. Nobody can get less than 10 grand, so that's just the minimum grant you can give out. So this money can be used for street outreach, getting with people in the street, in the woods, abandoned buildings. Emergency shelter, we know we need a strong shelter base for people to go that are in crisis mode. For prevention, for categories 2 and 4, for people who are at risk of becoming homeless. And then you can use the money for rapidly rehousing people. HMIS is capped at 10, admin's capped at 7.5. So those are on page 15 and 16. It lists out how you can use the money. For domestic violence, for the continuum of care chairs to know that we give a separate pool of money, MSHDA does, out of this to DV, out of MDHHS. So you're not to be, giving them any money to run their shelters, because we do that separately. We let DHHS decide which shelters are going to get that money. So out of this money that you get from MSHDA, none of that goes to fund DV shelters. However, if a man or lady comes to a DV shelter and then they do need rapid rehousing, they get moved over to the HARA, and the HARA can help them and provide them with rapid rehousing. Okay, and page 17, what I want to talk about a little bit is what's new for this year. For beginning in October 1st, what's new. And what we've decided on here is that tenants have to pay 1% of their gross annual income monthly. We changed this since yesterday, so this NOFA has been changed compared to what MSHDA originally sent out. So here's how it works. It's 1%, they have to pay 1% of their income towards their rent. There's no deductions involved. You don't have to get into, they got 2 kids, so then they get X number of dollars off, or they have to pay this high utility, so they get this money subtracted out. There's none of that you have to worry about. It's just a flat 1% of their gross annual income. So, for example, somebody makes $10,000 a year. What they would pay every month for rent, what they would be expected to pay is $100 a month for rent. So it's very simple to figure out, and the forms are here, and we'll give you the calculation worksheet. We did this same thing when we did the stimulus money. When we got the stimulus money that was the president, Barack Obama was in office, and we've got about $23 million in stimulus money, and we just used this formula. And surprisingly, it comes out pretty close to 30% a net. So anyway, it's 1%. But here's what we changed from yesterday. We added it to this NOFA this morning. Either the HARA can pay the entire rent amount, directly to the landlord and have the tenant reimburse that 1% to the HARA. Or the other way you can do it is you can just make the tenant pay the 1% directly to the landlord. You'll have to talk about this at the local level to see which way you want to go. It might be easier to just pay the landlord the entire amount of rent and let the tenant pay the HARA back if you want to build really solid relationships with landlords and you don't want to worry about landlords getting skittish on you because you're making this homeless person pay rent and they don't know if they're going to get their rent. So, or you might not want to go that way. You might want to just make the tenant pay the landlord directly. It's up to you, and we leave it up to you. The thing is, if you go the route where the tenant has to pay the HARA back, in this case, the case I gave you earlier, the tenant would have to pay the HARA back $100 a month, right? You can take that money and use it for things such as maybe getting ID for homeless people, or you could use it for multiple things like getting ID for homeless people, providing transportation for them as they need it. In some of the rural areas, transportation is a big issue. You might create like an account where for damages that you can pay landlords back out of. The money is free, back to the HARA to use as you want. So it's simple that way. We left this simple, and we also left the decisions kind of up to you, which way you want to go. And again, it's a simple calculation. It's up to you. If the tenant pays you that 1%, it pays the landlord that 1%, or pays you the 1% in rent. And the next pages just talk about how you figure it out, and our forms and all are really simple to use. So I think you'll find that part of it easy. And the reason we went to this at all was because it's just kind of a national best practice. I mean, it truly is. Most of the folks administering ESG in the U.S. are making their tenants pay some part of the rent. And it gets them kind of geared up to get on the Section 8 voucher if that's what they need to do. So, it's just important to also to be very strategic in your coordinated entry piece, in that you are kind of steering people who need a voucher. They have mental issues, or it's just big issues, health issues, things they're on Social Security, things they're not going to overcome, and maybe they're getting up in years and they get a voucher, but you also don't want to make people dependent on the system. So then again, like the younger folks who you think should, get some education or get to work, that you don't get them on the voucher. So you kind of have to be very strategic in your coordinated entry piece as well. So that is this presentation at this time and where we are with the NOFA. I will be sending out something that says, hey, we changed the back piece of this NOFA since it was originally issued, and under this new stuff for 2018, and I'll explain that a bit, send it out again. But other than that, that's all I have for a presentation, unless I have Michelle in the room. I think Nikki might be on the phone, unless you wanted to add anything. Beyond that, just type in your questions. Okay, we have questions as well. So first of all, Nikki and Michelle, did you want to add anything, or I don't know if Nikki's on the phone, but anyway, we'll just start to read off some of the questions that you have.
Okay, one of them is, it looks like Muskegon was left off the Region 4 list.
Oh, okay. Sorry, Muskegon, we'll add you.
Will you accept the TAY transition age youth in place of VI SPDOT for RHY age 18 to 24?
Okay, the question has to do with youth, and I guess there's a youth SPDOT, and can we use that for kids 18 to 24?
The only way you can use it is if you're comparing them to another youth program. So if they're going to the HARA, you would just do a regulars for that, because then it would be compared to to the rapid rehousing program. But if there's a youth program and you're doing it, if you're comparing a youth to another youth program, then yes, you can use it for another youth program.
What will be the fiscal reporting requirements if we ask the tenant to reimburse the 1% to the HARA?
We talked about that a little bit yesterday in a meeting, and to be honest with you, we don't have a totally solid answer. We don't have a form to give to you at this time and say, here's how you do it. But, it'll just, basically, you can use this money because you can use this money for pretty much what you want. In fact, but the only thing you cannot use it for would be like for meals, like bringing food into your agency or for throwing a big Christmas party or something like that. But beyond that, I mean, you can think creatively and think up ideas to use that money. And it's just going to be like making a list of this is the money that came back and here's what we spent it on. And I'm sure we'll be developing something for you to use that way. But it can be, you could even think up somewhat of a family self-sufficiency type situation where the tenant still ended up with getting that money back. You can be creative with it. Things that come to mind, obviously, are things like people need state ID fund money to help people get their IDs, or just that maybe you need more rapid rehousing or prevention or transportation. I don't know. Those are just the ones that come right to mind.
But you want to also include it in your Exhibit 1 under your financial guidelines, however your COC decides to use it. If you want to do it as 1% coming back to your agency, you should be able to log it as program income and set up an account under program income in your general ledger, showing where the tenants are paying that 1% to you. And then in your financial guidelines, when you submit that, you should be able to state how you're going to use it. Like if you're going to use it for IDs, or if the client needs, if you're done the 6 months of ESG and you can't do any more, and you have this program income and you think they need a little bit more or something like that, you should be able to put all that of how you're going to use that. And then if you change it along the way, you should talk to your homeless assistance specialist and send them something updated how you're going to use it.
I was talking with Kelly yesterday, who is my boss, and she said it's just, HUD looks at it like if the tenant's paying you back, you've basically already spent that ESG money on rent. You spent it already. You've paid the landlord. Now the tenant's paying you back with it. HUD sees it as though you spent it. So it's just kind of, when it comes back to your agency, it's like if your agency would get a donation and how you spend that money, those are kind of the same principles you would apply to this money.
As a donation. Yeah. So it'd be set up in your ledger as program income. And when you submit your FSR, you can show program income, just showing us that you have collected some of your tenant's rent. You don't necessarily want to bill it under your FSR because you want to keep it as a separate thing from your FSR. But it's just program income.
It's kind of like everybody kind of wants to overthink it. I was doing that as well. I think it's nothing that's going to be a big deal, but it obviously anytime you're getting money into an agency, you have to account for it one way or another.
I don't understand the use of ESG form number 9 being mandatory instead of accepting pay stubs. Waiting 10 days for a landlord to not return the form slows down housing.
If you have the pay stubs, you can use the pay stubs. The ESG form 9 is if you do not have copy of the pay stubs.
We can clear that up on the form too. We'll clear that up in the NOFA and on the form. And because of the change we did make in it, again, I will be sending this out again statewide and I'll note where changes were made in it, in the NOFA document.
So Tina Allen will write all of those letters, or a single letter?
I'm sorry?
I think they're talking about.
They're talking about page 7, I think it was, where the measures are, and the last measure has to do with, did they spend down the money or not?
They will only do that if it's for a COC-funded agency, a COC-funded program.
Yes, it's not really for the
Balance of state.
balance of state. It's who's going to need that letter, or say like Lansing, if they have a COC program.
It's mostly for independent
Thank
jurisdictions.
you.
The balance of state communities, we would just get that from the balance of state coordinator.
Yeah, we have that information right in-house here for the if you're under the COC program with MISTA, we have that information in-house. But who we don't have in-house are the independent jurisdictions or the big cities. Independent jurisdictions like Grand Rapids, Detroit, Lansing, Muskegon, groups that go directly to Huddle on their own.
Can I use this money to rehab a shelter? We was closed for a few years.
No. This is for the HARA. The HARA. It goes back to the HARA. It doesn't go back to the shelter.
And yeah, that's a good question, though. And if you do have questions like that, just shoot them to your homeless assistance specialist. If you have something that's kind of outside of the ESG program itself. One thing MISTA hasn't done in a long time is done a lot of. We haven't given out money for shelter facilities really in quite a long time.
Oh.
So, but yeah, just ask your specialist when you run into questions.
Who is Region 9 specialist in numbers? Grace Haven is located in Jackson.
That's Nicole Shallow, does Jackson, right?
Yes.
And we can get you, we'll try to we'll put the map out there again. We're going through some staffing changes right now a little bit, and we'll put the map, and the map is on the Campaign to End Homelessness website. We can, I don't know, I guess we can shoot that website with that link to folks, or just, I don't know.
Okay, please clarify the caps for HMIS and admin, as the doc states 7 for admin and 3 for HMIS.
Yeah, well, I apologize for that. That is incorrect, and that's something that unfortunately is from a document a couple years ago. So hear this and listen to this. The cap for HMIS is 10%. For admin, it's 7.5%. Just know those two things, and I'm going to be sending out a new NOFA and listing the changes that have been made. But the NOFA that you have in front of you with that 3% is obsolete.
The 1% decision will put additional administrative burdens on the HARA. Is there additional funding coming to administer the 1% requirement?
If you do not want to collect the 1%, we looked at this as a way of the HARA getting extra income. But this is something that if you don't want to do the program income, you can just have the tenant pay the 1% to the landlord.
Yeah, you just have them pay the landlord the 1%. You still do have to figure it out, but it's just a minimal calculation, and also we moved to it. We thought long and hard before we did, and we did it because it's a best practice. It gets people ready to pay rent and like that, and holds people accountable. We did want to make it as flexible as we could, though, and we tried to keep it as simple as we could.
They want to know what the rationale for the 1% is.
When we did the stimulus money, that was like $23 million we did, and we got it all out the door out here at MISTA, and back in probably 2009. And what we did, when we looked at it, we did some analyzing of it, and when you do 1% of the gross income, it's very, very similar to 30% of net. Like if you take somebody's income, like HUD on the ESG program says, on the HCV program, on the voucher side of stuff, they say people should be able to pay 30% of their income towards their rent. Well, there's all these deductions involved in it, like for kids and for medical and just different types of things you can write off. But when you do a 1% of gross, it's very close to the same as 30% of net. So they're very much the same amount.
And when you also look at the population that we're serving, most of them, if they get pulled for a voucher, the minimum TTP, even if they have zero income, is $50 a month. So we're trying to get people used to start paying something on their rent, because if we're not helping them learn how to pay their rent, we're kind of setting them up for failure, so that when they get pulled for a voucher and they start having to pay at least that $50, they'll understand that they have to start paying something on their rent. So as best practices, if you go to some of these conferences that the NAH does or CSH, you will find that most other states, they are making tenants pay at least 30% of their rent. So we're just starting with 1%, and we're allowing this to be used as program income to your agency to assist you with things that might come up along the way, that you can use this money any way you want to.
And you can also put that money, if you want, back into your case management, because another goal with this was, when we initially started here, of having the tenant pay the HARA, the 1%. Our original goal was along the lines is that you would meet with the tenant every month, and that you could build that money back into case management. The tenant pays the HARA, that 1%. You can turn that money back into case management money, because it is more, like somebody was saying earlier, it is more burdensome to figure out the 1%, and to meet with people monthly. That adds a little extra work on your end there. But we think that by you guys taking that money back into the HARA and then doing that extra case management, it hopefully benefits the people. That's the only where we're coming from.
Did Janet say ESG funds are supposed to be used for Cat 1 and 2 households only?
It can be used for Category 1, 2, and 4. You can't use Category 3.
Yep. Thank you.
Are the paid performance only measuring ESG clients that have an HMIS entry, or are they based on all housing programs within the COC geographical area, no matter the funding stream?
They're looking at all.
They're looking at all programs
within a COC.
And it's Shanna Cherubini with Micah. She'll help you run your numbers and explain further to you on this. She is behind these calculations and behind what goes into them and how we pull them. So, like a computer programmer, she knows what goes into getting the answers out of these, because she worked with Mishta very closely to create this for us. So she would be your go-to on running the numbers and knowing what's behind them.
And the last question is, will the fiduciary be responsible for monitoring the rent contribution?
We'll build that in. We're gonna have more conversation on that here before October, and we'll look at that a little further as to how that's all gonna come together.
Okay, that looks like all the questions.
Okay, that was all of our questions, and we will send out an updated NOFA with anything we talked about that's changed in a cover memo, highlighted out and then attached will be the new NOFA. And we'll be talking a little more with you before the time comes to implement this stuff on just kind of record-keeping stuff, record-keeping in the background on that 1% if the HARA is getting it back. Any comments you have or thoughts afterwards, just shoot them to your homeless assistance specialist. And thank you for your time today, and I'll talk to you soon. Okay, bye-bye.